Sorry, good afternoon, everybody. I thought I was not muted, but guess I was. And I'm trying to multitask and get attendance in as well. Shelby just showed up, and it's Brianna, yep. And Miss Natalia. She's the only one I'm missing. Okay, so far. How is everybody? How was week one of this second little term? All at once now, we have 5 hours.
It was good.
Okay, all right. So y'all are taking, you started communications this week, right? It'll prepare you for your presentation, right? A little bit of a speech. You know, do you get points for that? I'm kidding, guys. Let me let Miss Natalia in. I have a very wonky sense of humor. I laugh at a lot of dumb stuff that's funny to me. Laugh with, even if it's a fake laugh, I'll take it. Okay. Okay, so in the, making sure Natalia's here. Okay, in the chat box, I have an amazing friend who teaches at a school up in New York, dental hygiene program, and she had asked me a couple months ago, are you teaching embryology and histology again? And I said, you know what, I'm not. And so I kind of disregarded it. But then I was given the class back, right? So not that it was taken away. She wanted me elsewhere. I need you guys to know that. I was not removed from the class for any reason other than the fact she wanted me somewhere else. And so my friend sent me this book, and it's an ebook, and it's really, really cool. So here, so the link is in there. It's free. It's a download, or you can just click on the link and go to it and look through it. But I like that it gives like interactive, especially like later on this afternoon, we'll talk about tooth formation, the development of the actual teeth, and it gives a really cool like interactive looking view of how it goes from the different stages in tooth development, the bud stage, the cap stage, the bell stage, and it kind of shows how it does that. And so I thought it was really cool. I kind of nerded out. That's what I do. You'll learn that a lot. I nerd out, and then I send my nerdiness on to you. It also really, I mean, it goes into a lot more detail, I feel like, but it is a book for dental hygienists. But I feel like, you know, obviously that's not the stuff that you're going to be graded on, but I thought it would be a really great supplement for you, like, especially because of the pictures. I thought it was cool to understand for understanding purposes. So Monday, I feel like it's been forever since I've seen you guys. Monday, we discussed prenatal development. We talked about the pre-implantation stage and the beginning of that embryonic stage, right? So we talked about what happens in that first week, and then weeks 2 through 4, we really kind of talked about the development of the head and neck and how that happened. And then we broke it down even a step further and went into, there's your generic prenatal development, right? But then we went ahead and broke it down a little bit further and said, okay, well, now we talked about the face and the neck and how we have it has those branches, there's fusion. And so today we are going to go into a little deeper from the face and neck, and we're going to hit on the oral facial development. So really like the mouth and the throat area, that area right there. And then we'll take it one more step and just look at those itty bitty teeth development that goes on in there. So when we talk about oral facial, we'll talk about palate development. We'll talk about the development of the tongue and how it literally just almost like swells into formation, which is really kind of neat. And then we'll talk about each tooth and how each tooth develops. And it's from the, from where we started on Monday to to this point, and then we're done with embryology. And that's all you really need to know for the embryology part. I will let you know now ahead of time that when you get like to the end of this process and you go to take your national board, they do have several questions on the stages of tooth development: your bud stage, your cap stage, your bell stage, your appositional, and your maturation. So that's why that chapter is a little bit bigger, if you guys didn't already notice that when you're reading, right? So, so here I'm gonna, let's see if I can, I'm gonna close out here. Any questions for me? I have a really, really bad time with checking the chat box. So just ask the question. Don't feel like, you know, we can all learn from each other. That's just kind of the way it goes. So any questions about anything we discussed on Monday, or that we discussed and then you went back and reread on Monday that you have?
I have a question about the link you were saying. I didn't get it in the chat box.
It's not in the chat box down. I sent it to everyone. Here, I'll paste it again. It says openumn.edu. Does everybody see that? Okay, yeah. All right, I am going to share my screen. Oh no, I don't know what I did that for. Okay, so here is like the book, and I'm gonna pull this up and come up here. But this is the first thing I saw that I was like, this is pretty neat. So we talked the other day about are you guys seeing there's like usually it turns green, but maybe that's on something else that I look at. You see the trimester, first trimester, second trimester, it's like a table. Okay, so obviously, you know, our first trimester is that, you know, usually around that, you know, 12 to 13 week. And so they kind of broke it down because a lot happens in that stage, right? So you have your 1 or 2 weeks where you have your implantation, and then you have your embryotic and your fetal stages, right? And the fetal is where all of the continued growth happens. Like, you know, all the details happen in between that pre-implantation and that fetal development. But like, look at all the things that happen during that embryotic, and they finish up in the fetal period, but they really start in that embryotic phase, right? So you have your the neural crest migration, like we talked about the other day, with because we use those neural crest cells in the formation of the oral cavity. The heart starts to form in that 3 to 6 weeks. The pharyngeal arches, which we talked on the other day. We'll learn today about the palatal growth that starts at the 6 week part. But while the palate is growing, the tooth buds are already starting inside the jawbone. And then your limbs start to bud in that, you know, 3 to 7 week stage. Your tongue develops there at the, you know, in that middle 4 to 5 week. Your salivary glands, and then your ossification of your bones really starts, right? So so much happens in that embryotic phase. And we mentioned that the other day. It may be a test question. Most things happen in the embryotic phase. Star that one in your book. So yeah, I mean, I just thought that this was a great picture of how that works. There were several of this. So this is the stuff that we went over the other day, the early development. But see what I'm saying? Like they start to clone, and you know, there's little cells, and once they start to clone each other, they determine what they are. Meiosis, we've talked about this all the other day, but you know, when the cells differentiate, that's when they determine whether they're going to become odontoblast or fibroblast or cementoblast. Another question on the quiz may be, what do they turn into? And I think I mentioned that the other day: odontoblast, cementoblast, and fibroblast. But I just thought that, like I said, this is really kind of, and we went through all of these the other day. But again, just another review, like something you can look at to maybe help it stick a little bit better. Let's see. This one I thought was really neat because we talked about appositional growth, and remember appositional growth is, if I go back to my, let's see, if I can hit on it, where is it? Is it here? Yeah, your appositional growth is that it increases in diameter, whereas your interstitial growth, it gets that size by adding the tissue. So you can see here that there's your interstitial because it grows bigger, but your appositional just grows like on either side. It gets the diameter gets bigger. So I thought that was kind of neat. Here's a great representation of like your when it starts to cause budding, or the invagination, when it starts to bend in or make the different. I talk with my hands a lot, so let me make sure that I know there's one more student I'm waiting on, and I want to make sure he's not here, but I haven't seen that he is here yet. So so yeah, just here's the fusion. Remember I said that the two pieces come together and then they kind of fuse together until they, two separate structures come together with their tissue. And we'll talk a lot about that today because that's what happens with our palate. But I don't know, like I said, completely nerded out, and now you guys get to really be part of that nerd out. Oh, here's your proliferation when it, you start to get that line through. Talks about the different embryonic layers. And then here, remember how you have your ectoderm, your endoderm, and then it kind of, you get that the mesoderm that comes from that ectoderm up there. And so your ectoderm turns into your epithelial, the epithelium of your skin, your oral mucosa, your neural tissue. Your mesoderm becomes your connective tissue and your muscle tissue, and then your epithelial lining is for your hollow organs. So, all right. Have fun with this is what I'm going to say, right? All right, and then let's see. I think this kind of all went into the pharyngeal arches we talked about. Remember they said that they don't call them branchial anymore because of the gills, but my daughter said that this is quite scary and ugly. I thought that was funny. They are off on, you would get to meet them. However, they're off at the skate park right now. My son got a new skateboard for his birthday yesterday. So here's another great chart, right? So you have your first arch, which is your mandibular arch, your first pharyngeal arch, which turns into your mandibular arch, the ectoderm and the neuroectoderm, the maxillary process, the upper lip epidermis. There's no groove state, but then there's the mesoderm and the neuromesenchyme state, what they turn into. So it's just like, I feel like it breaks it down in a much nicer, prettier way for maybe those visual learners that need to see. And then, oh, this was, how it all, there's your little arches and they're starting to come together. There's your mandibular, your maxillary, and comes together with you're like, great, Miss Calhoun, we see it, we see it. Right there. Let's see. All right. Oh, we are going to talk about the palate, but remember I said the palate starts, and I couldn't remember off the top of my head where it started and where it ended, but it meets in the front, in the anterior first, and then it seems like a zipper right down the back. So we'll talk about that a little bit more today. And so this will come in handy in just a few moments. So, all right. This is where I get all discombobulated with this thing. All right. All right, so we are going to head into chapter 5. Oh, someone asked me, so what I am going to do this evening is I am going to make, because I feel like in this class, other than like in process of care, you don't need to have the slides up so much. Whereas for this class, it's a lot of pictures that help to connect what we're trying to learn and know, right? So I usually, like for process of care, and you'll laugh at me, and I may have said this earlier, but I have a podcast for that one. So you have the link to the podcast, and every time I put a new recording on there, like for when I teach process of care. For this one, like I said, I have all but chapters 3, 4, and 5 already recorded via Loom. And so I will send you the link for those so that you can watch chapter 6. And it's just to refresh your memory if you need to, like, and I'm recording this lecture. So, I can just always send you this too, so that you can have that to study or if you need to hear something again. Okay, so chapter 5, your orofacial development. Let me pull up my, that's chapter 6. There's chapter 5. Okay. Okay, so like I said, if you have, am I sharing my PowerPoint? Okay, got it. Thank you. I will ask you that a lot because it, I never know what you can and cannot see. All right. So the chapter 5, when we further going, like I said, we're going back into, we've started with this overview of prenatal development. And now we're going to jump into the oral facial area, because we already did like how the face develops and the neck develops. And the formation of the palate, so the development of the orofacial structures include the palate, the nasal septum, the nasal cavity, and the tongue. It occurs from the 4th to 12th week of prenatal development, spanning the latter part of the embryonic period and the early part of the fetal period. The formation of the palate initially in the embryo and then later in the fetus. So like I said on that, it might start in the embryonic stage, but it completes in the fetal stage. It takes place over several weeks of prenatal development. So let's see if I'm gonna, that way. So going straight into palatal development, the formation of the palate starts during the 5th week of prenatal development and within the embryonic period from 2 separate embryonic structures, one being the primary palate and the second being the secondary palate. So the palate is formed between starting at the 5th week of prenatal development from 2 separate structures, one being the primary and one being the secondary palate. The palate is then completed later during the 12th week. So you should know, because it ends at the 12th week, by the 12th week, whether or not a fetus has cleft palate. Because remember, the lip develops by the 6th week, the 4th to 6th week. You'll know if there's cleft lip by the 6th week of prenatal development. But for the palate, palatal growth is not complete until the 12th week. So therefore, it's important that we know those numbers. Those numbers will not only come up on like potentially this quiz or the final. That question could come up in process of care because there's a whole section on cleft lip, cleft palate. So these are just things I'm, that that are important. Here is that nice, let me see if I can do this better. Hold on. If I stop sharing, close this, make, ba, ba, ba. Whoa, that's not what I want to do. Hold on. There we go. All right, can you see my PowerPoint? No, you can't see it at all. Okay. Oh, because I didn't share it. Duh. All right, there we go. Is that better? Can you see it now? It's operator error. It's a real thing. I have it. Yes. This is why I don't like Zoom. I'm much better in the classroom. Who am I kidding? No, I'm not. Let's see. Okay, so here is our palatal development. It's a very nice little structure. Fifth to sixth week, that primary palate, the intermaxillary segment. Remember, that's that segment that is basically the most anterior portion. So if you were to, cleft lip usually comes from the nasal septum down. So it's basically from the lateral incisors, which are not your front teeth, but the ones right directly to the side of those front teeth. From the lateral to lateral is your inner maxillary segment from the fused median nasal process. And then from 6th to 12th week, you have a secondary palate, and that's the fuse of the palatal shelf of the maxillary process. And by the 12th week, the palate should be finalized. This is a picture in your book. It is on page 45. Everything I am reading off of here comes out of your book, and it's because of the fact that the test questions come straight out of your book. One way that I make sure that there are no discrepancies in the answer key is I go through and highlight everything that is important on those tests. There might be 35 or 40 questions on the test bank. I might only give you 10, but I make sure that you know that I have told you everything that could potentially be on the test. Okay. All right, palatal development. So the completion of the final palate involves the fusion, and or swellings. And like that little video that I showed earlier, it kind of like comes together and then they swell until they join. And so the swelling or tissue from different surfaces of the embryo to meet and join, similar to that of fusion of the neurotube. Remember when that neurotube, you had that differentiation and then it fused up here at the top. So, and the components of the upper lip, whenever the philtrum and then the maxillary came all together. In contrast, most of the other structures of the orofacial region develop by the joining of swells and tissues from the same surface of the embryo, which leads to the elimination of furrows or between the facial processes. So instead of having like, almost like in this picture, like a little discrepancy, it's much smoother. During the 5th week of prenatal development, still within the embryonic period, the intermaxillary segment is formed. And you can see that this is a side view of this picture. And I think this is the one that I can like zoom in on. And then you can't see my hand, I don't think, here on, but maybe you can. But you have your developing nasal cavity in this dark purple or dark blue. This is where your nostril would be, okay? Your intermaxillary segment is that area right there in between from the nasal, the nostril and your stomadeum, right? Your primitive pharynx and your stomadeum, which is your primitive mouth, right? And then you have your lower lip right down here. And then it develops even further, and we'll get into this a little bit more, where you your intramaxillary segment forms into the primary palate. So it forms this, you have your nasal cavity here, your developing nasal cavity. This is your nostril. You can see here's your primary palate. That it's just right there underneath, like underneath your septum. And then you have your tongue here, and then you'll start to get your palate that will form together. Any questions about this? There we go. Okay. All right. Here it goes even further. It's still your nasal cavity, and it's this is that embryo at 6 weeks. The head is showing the development of the intermaxillary segment from the fusion of the median nasal process on the inside of the stomadeum. So again, this is where it's cut. So this is like that side that, like, you can see. I'm like trying to point to this, but you can see like this whole part because this is cut. All right. So your primary palate. The intermaxillary segment also gives rise to the primary palate, or the primitive palate. At this time, the primary palate also serves only as a partial separation between the developing oral cavity and the nasal cavity. So if that primary palate hasn't, there's still that opening, like there's nothing shutting off the nasal cavity from the stomadeum at that point. Does that make sense? Because it's all still coming together. Let's see. In future development, the primary palate will form the pre-maxillary part of the maxilla, which is the anterior 1/3. So that that pre-maxillary part that we just talked about will turn into that wedge. It's very hard for me to explain. It is. Let me see if I have a picture of it on here real quick. Here. So here's your primary palate. So it's that intermaxillary segment right there turns into that primary palate. Does this help it make sense better? Yes. Because you're all looking at me like I'm speaking Greek. Am I speaking Greek? A little bit? No. So yeah, so that intermaxillary segment, that one that comes down in between the nasal cavity and your stomadeum, will eventually develop into this very small area called the primary palate. Okay. And then you have your developing, this purple part is your secondary palate. These are your palatal shelves that will come together, and it will fuse here at the median line. You can see here your nasal septum is there, the developing nasal septum. So once it all comes together, you have that median suture on your palate. So if you've ever looked in anyone's mouth, you can almost see that line where it comes together. And the way it forms, you can see in this picture here, is it starts here and connects here, and then it kind of zippers together. So it like comes together, and then it kind of zips together. All right, let's see if I can go back a little bit, and then I think I just explained everything I'm going to talk about, but yeah, secondary palate formation right there, boom. All right, during the 6th week of prenatal development, within the embryonic period, the bilateral maxillary processes give rise to the 2 palatal shelves. So you can see right here, here's your 2 little palatal shelves. This is your developing tongue. So imagine you're cut like right here, and you're looking at someone from the back. Does that make sense? No? So take someone just the back of their head and cut them right here, and it's like you're looking at them from the back of their head. And so you're seeing in, and you can see the shelves. developing and coming together, and the tongue is eventually, it looks like this, you know, because it's like a kind of a small area. I mean, think about this. This little thing is probably about this big at this point, right? You can't even, at this point, I don't even know that you can pick it up on an ultrasound, because you're like, well, 6 weeks you can, yeah, but like it's not, the heart is starting to develop at this point. So, you know, this is really tiny little features, right? So that palatal shelf in the back starts to develop. And when it starts to develop, it's like the tongue gets pushed down, because it comes, you see how it comes together. Like these two, the palatal shelves start to form down this way. They start to go, you know, come down vertically, and then they swoop up to form that palate across. All right, as the developing tongue muscles begin to function, the tongue contracts and moves out of the way. And you can see that right here in this picture. The tongue kind of gets pushed out of the way of the developing palatal shelves. Thus, the tongue avoids being an obstacle to the future fusion of the palatal shelves by moving both anteriorly and posteriorly. So forward and you know, back, it kind of, instead of it just being this big swollen piece of tissue here, it kind of falls back and out. All right. So the secondary palate, let's see if I can find that on here. The secondary palate, which are those two shelves that come together. You know, the secondary palate are these two light purple, whereas the dark purple is the primary shelf. The secondary palate will give rise to the posterior 2/3 of the hard palate. So the anterior 1/3 is the primary palate. The posterior 2/3 are the secondary palate. And these contain certain anterior and maxillary teeth, which are your canines. And they also give rise to your posterior teeth, right? So you're, you know, as you can see here, I'm going to make this bigger here again, that primary palate is your centrals and your lateral incisors. So it's your two front teeth and the two teeth on the side for your maxillary palate. I mean, you know, for your palate. So that line would almost go here and here if that was, I don't think I'm able to do that, but so here's your lateral. So it's almost like from here to here is your primary palate. Does everybody get that and understand what I'm, okay, good. Thank you for your response. All right. It also will give rise to your soft palate and your uvula. And as we'll learn with palatal complications or issues that can happen, your least severe type of cleft palate is a bifid uvula, and that's where your uvula is split in two. Has anybody ever seen that in clinical? Yeah. So yeah, they have this little, it is actually a form of cleft palate, but it's obviously not causing any major issues. All right. Okay, so to complete the palate, the posterior part of the primary palate meets up with the secondary palate due to increased growth, right? And these structures gradually fuse in an anterior, like I said, like the primary palate and the secondary palate meets first, and then it comes together like a zipper. So anterior to posterior, front to back. When these three processes completely fuse, they form the final palate. It includes the hard and soft palate, and it happens during the 12th week of prenatal development. Now the mature oral cavity becomes completely separated from the nasal cavity, which has begun to undergo development its nasal septum. So before everything happens, our nasal area and our mouth they're all they're all open. And then with the forming of this palate, it closes off the nasal cavity from the oral cavity. Okay, so here's that picture that I showed earlier of how that palate you get that full palatal completion. Any questions about this picture? Anything that you guys, okay. Here you can see, here's your, I'm gonna grab a little laser pointer. You can see here's your oral cavity, there's your tongue, there's your nasal septum. And so here are your palatal shelves starting to go down. And then here's your palatal shelf starting to come across. Then the septum meets up at that fusion spot, and then you have your full palate complete. Here's that same picture that was in there a few minutes ago. All right, so here's your clinical considerations for palatal development. So you will get to know there are 7 different degrees or classes of cleft palate. You will get to learn them a little bit better, like I said, in process of care. But the failure to fuse the palatal shelves with the primary or with each other, it results in cleft palate. And like I said, there are varying degrees. Your letter A up there in this picture, it is in your book on page, what page is that? 49. So you have, that's everything is together. You have your primary palate and your secondary palate, but then you have that cleft uvula you see in that one picture where just the little, hangy bally thing in the back of your throat is split. Yes, I said hangy bally thing in the back of your throat. The letter A or B is where you don't get fusion of the secondary palates. Something that an issue that will happen in infants that have something like this is they can't get that sucking motion to nurse. So they end up with like milk getting into their nasal cavity. And not being, and they end up failure to thrive because they can't eat. So what they do is they put what's called an obturator in. It's a, you have to take an impression to get it made to perfectly fit. And so then it goes into that space so that the baby can eat and not be, and be able to get their nutrition. Letter C, you can see there is failure to fuse on the left side of the primary and the secondary palate, as well as failure to fuse in the lip area. And then D and E are both your, D is your bilateral cleft palate, and that's where, or your cleft lip, where you, well, cleft lip and cleft palate, sorry, where the primary palate fails to fuse with the secondary palate. However, E, final picture, is where you get complete, you don't get fusion at all anywhere. And so I have seen, like I said, I used to work with the cleft lip, cleft palate team in Jacksonville, and I have seen some amazing, amazing work. I always say if I ever have damage to my face that I ever need to have a plastic surgeon do any type of reconstruction to me, I'm going to Jacksonville and I'm going to have Dr. Glassman do it, because I have seen him do some amazing cleft palate work, cleft lip especially. He's really good at what he does. This is a really hard picture, but I know it's in your book, but this is a child that does not have the primary palate did not fuse with the secondary palate, and you can see the secondary palates did not fuse it either. You can see back here. Here's a beautiful picture of that cleft uvula. it is the least complicated form, like I said, of cleft palate. Newborns with cleft palate also sometimes have a cleft uvula. The bifid uvula results in the failure of completion in the fuse between the median nasal process and the maxillary process. So I'm trying to skip here, so let's see what else. Bifid uvulas have less muscle in them than the normal uvula, which may result in recurring problems such as ear infections. They could have difficulty swallowing because their soft palate is pushed back a little bit, and this prevents food from entering the nasal cavity. So, all right. There you can see that, you have your soft palate and then you have your pharynx. So this is normal speech. If you have velopharyngeal insufficiency, which is VIP or VPI, you end up with, it's a disorder that prevents the velum or the soft palate from closing against the posterior pharyngeal wall during speech in order to close off the nasal cavity. And it gives you, which is needed for the production of most speech sounds. So that is another thing that can happen with cleft uvula. This is an Epstein curl. I don't remember that even being on. Nope. Okay. Keep moving. All right. Onto the nasal cavity and septum development. All right. So the nasal cavity forms in the same time frame as the palate from the 5th to the 12th week of prenatal development. And we kind of already know that because we know that as the palatal shelves are moving down and then moving across, the nasal septum is coming together to meet with that, right? So it will later serve as part of our respiratory system, which is true. All right. The future nasal septum of the nasal cavity is also developing when the palate is forming, which I already said that. The structure of the nasal septum, similar to the primary palate, is a growth from the fused median nasal process. So, you can see here, there's your nasal septum, and it's all going to kind of fuse together into that palate. All those little pieces are all going to come together. All right. So the vertical nasal septum fuses with the horizontally oriented final palate after the palate has formed. So the palate comes together, fuses together, and then the nasal septum comes down and it all fuses together. All right. Not on. Okay, so the verb, let's see. Yep, nope. Okay. I could read this slide to you, but it's, you read the book. I'm only focusing on the parts that I really would like for you to know. Jill? Does everybody read me, follow me? Good. Okay. All right, going on to the developing tongue. That part I'll read to you because it's important. The tongue develops during the 4th to 8th week of prenatal development. It develops from the independent swelling located internally on the floor of the primitive pharynx that were formed by the first 4 pharyngeal arches. It is specifically the body of the tongue develops from the first pharyngeal arch, and the base of the tongue originates from the 2nd, 3rd, and 4th pharyngeal arch. So first pharyngeal arch also does the mandible, remember? So it also does the tongue and this part. So whereas the base of the tongue is more, and I think when we're finished these slides, I'll go back to that other one because I think there's one where you actually get to see the tongue develop, which I thought was kind of cool on that little book that I sent you guys. So here is a great, another chart, 4th to 8th week, You get the body, which is the tuberculum, impar, and the lateral lingual swellings appear. And then the base is the copula with the is overgrowing, and the second pharyngeal branch arches. And then the 8th week, you have your completed tongue, the merging of the anterior swelling of the body and the copula of base. So we'll get into that a little bit next, I think, in this picture. So here are your branchial arches or your pharyngeal arches again. During the 4th week, the tongue begins to develop. This is that body of the tongue. The tongue development starts as a triangular median swelling of the tuberculum impar, or also known as the median tongue bud. Oh, skate park must have been a bust. They're back. Hold on. Let me just, yeah. Yes, I'm in class. Yeah. Do you want to say hi? They're not going to be able to hear you, but this is Lucy. You want to get in here and say hi? And that's Levi. All right, go.
Is that Hugo's? If Hugo's mom is coming,
you know that they can hear you. Oh, you don't want to ride with Mr. Julian tomorrow?
Yes, because the car will be full.
It will be full. Go. Go. We have an 8 o'clock soccer game in Manassas, or 8 o'clock or 9 o'clock in the morning. It's 8 o'clock in Manassas tomorrow, and we live in Southern Maryland, so we gotta get up really early, and we're bringing another family. I need to teach so that they can enjoy their weekend. The faster I talk, the quicker they can enjoy their weekend, right? Yeah, okay. Nobody wants to be here on a Friday afternoon. I don't want to be here on a Friday afternoon. Okay, so I shouldn't say that during the recording. Whoops. Okay, so it's the median tongue bud. So I think this is kind of neat. Here are your, here's your little alien baby. I know I had babies too. My babies were aliens at one point, but here's your little alien baby here. And then we all were at some point, right? And so here's your little lingual, you start to get that lateral lingual swelling. Here's your first pharyngeal arch. And then it starts to form. And I think that this picture in your book, picture 5-9, I think it does a really good job of breaking it down into the different colors. So you can see where the second branchial arch ends up being these palatine tonsils, and the base of the tongue is formed by the third branchial arch, but the first, or pharyngeal arch, sorry. But then your the tip of your tongue, the part that we actually see, because you have your foramen cecum here, which is really at the base of the tongue where you almost can't see that part. And we only really see that for what comes from the first pharyngeal arch. So, yep. So highlight this in your book. The tongue development begins as a triangular median swelling, the tuberculum impar, or the median tongue bud. Okay. All right. All right. So the two oval lateral lingual swellings on that's these little lateral lingual swellings here, or distal tongue buds, develop on each side of the tuberculum impar. The paired lateral swellings grow into size and merge with one another to form, the part that we stick out at people when they're ugly to us. Then there's the few swellings overgrow and encompass the disappearing tuberculum impar to form the anterior 2/3 of the mature tongue, which is the anterior 2/3, the largest part, right? Which lies within the oral cavity proper. All right, so the median lingual sulcus is a superficial demarcation of the line of fusion of the two lateral lingual swellings. So that is your median lingual sulcus. And if you stick your tongue out and look in the mirror, you'll see one too. All at one time. No, I'm kidding. Yeah. So as well as, you know, it's the two lateral swellings as well as of a deeper fibrosis structure. That was a lot of too many words right there. So it gives that fibrous structure that makes it look like almost like those two just fused together the whole time. And now that you learn this, you look at it and you're like, oh yeah, I kind of see what it's talking about right there. All right. Let's see. Oh, we're on the last page of chapter 5. We're gonna be out of here real quick. Yes. All right, so let's see. Around the lingual swellings, the cells degenerate, forming a sulcus, which frees the body of the tongue from the floor of the mouth, except for the tiny little attachment, which is the lingual frenum. And that is the little tissue tag that if you put your tongue on the roof of your mouth, you'll be able to see that, right? So that's your lingual frenum. Some people's lingual frenum, because of the fact that the cells don't degenerate from the sulcus and don't obliterate in those areas, is the fact that you end up with what is called ankyloglossia, and we'll talk about that in a minute. But that's when you're tongue-tied. Oh. So it will just pop up and tell me if somebody was, where did she go? Oh, she's trying to get in and there we go. She was here and then she was gone. I don't know what happened to her. Okay. All right. So yeah, so that's at your midline on the ventral surface, the underside of your tongue, and it is attached. We'll learn, well, I guess you guys learned about the sublingual caruncles, which, you know, your sublingual glands come out. Yeah, that's where your good saliva comes out of to form calculus on your teeth. We'll get into that later. Okay. Immediately posterior to these fused anterior swellings is a pair of swellings called the copula, which becomes evident. All right. The single midline copula is mostly formed from the fusion of the mesenchyme. Is that on here? No, or maybe it's on that. Yeah, it's on there. From the mesenchyme of the third and parts of the fourth pharyngeal branch. So the single midline copula is mostly formed from the fusion of the mesenchyme of the third and fourth and parts of the fourth pharyngeal arch. But yeah, there's so your copula is this middle section. It doesn't show it on the actual tongue, but like you can see it in the early stages, and then it starts to form a little bit differently and, you know, push everything forward, if you will. And then how many of you have kids? One, two. So if you know any little kids, like around 3 or 4 years old, if you have them open at, like, look down their throat, sometimes you can see their epiglottis. Has anybody ever noticed that? And it's kind of weird because people, you know, my sister-in-law called me one time and was like, oh my gosh, I can see my daughter's epiglottis. And I turned around and I did it to my daughter too. Well, because it doesn't, it's like 4 to 6, I think it says in the book, it starts to, that's when it starts to hide and become, like, because as adults, we don't see it. But in kids, it still kind of rears its little head up and it looks like, you know, the alien is coming out of their throat. So if you ever work with kids and you have them stick their tongue out and look down there and you see this little epiglottis thing poking its head out, don't freak out and call anybody. It's normal. But okay, y'all are killing me. Come on, somebody laugh at me. It's true though. It's true. Just, you know, I hate not being able to hear you. All right. So the copula gradually overgrows the hyoid arch, which is considered the second pharyngeal branch. So you can see where it starts here in the third, but then it pushes its way forward, which is why the second pharyngeal arch ends up becoming the lingual tonsils, and the copula ends up pushing to become the base of the tongue. I feel like yeah, okay, I'm gonna stop talking. The overgrowth will form the posterior 1/3 of the tongue, because the anterior 2/3 is the part that's in our mouth. This forms the base of the tongue. All right, even further posterior, so past the base of the tongue, you get a projection of the third median swelling, which is the epiglottic swelling. This swelling marks the development of the most posterior region of the tongue and the site of the future epiglottis. And here it is right here. So it's all like, you know, it's all one structure, that base of the tongue. Loose, yes, should be. All right, so the completion of tongue formation. As the tongue develops, still further, the copula of the base of the tongue, after overgrowing the second arch, merges with the anterior swelling of the first arch to form the complete body of the tongue, both the anterior portion that is in our oral cavity proper, and the part that we try to look at whenever we tell people to stick their tongues out and look at their, you know, circumvallate papilla, which you'll learn again later if you haven't, you know, if you don't know. It's the big, there's like 13 of them in the back, and it makes a V. You can see them right here in our throat, but you know, it looks like that's the whole, you know, but we don't even really see that part. They have to stick their tongue out in order for us to see that. It merges with the anterior swelling to form during the 8th week of prenatal development. All right, let's see. Boom, boom, boom. Return this fusion. Okay, so this fusion is superficially demarcated by the sulcus terminalis, which is behind where the circumvallate papilla are. So here I'm going to blow this up. If this can, oh, there we go. So you can see here's the body of the tongue. This is the part that, Miss Tara is having a difficult time getting in here. So you have your circumvallate papilla, you have your sulcus terminalis, which is back here, and then you have your foramen cecum, which is this little V here. Then you have these are your lingual tonsils. Then you have your palatal tonsils, which you see in between those two, the anterior and the posterior pharyngeal arches. Those palatine tonsils sit right there. And then our epiglottis is at the back there. And that epiglottis, you know, is supposed to keep things from going into, you know, going down the wrong tube, right? So, so basically I said all of that. It is in your book. It is right there on page 51 in the right column, completion of the fusion of superficially, okay? And then the sulcus terminalis points backwards towards the oropharynx. And like I said, this is the sulcus terminalis. At a small pit-like depression, which is called the foramen cecum, which again, we really can't see unless we take the entire tongue out of the mouth, which doesn't happen, which is the base of the thyroglossal duct. This duct shows the origin of the thyroid gland and the migration pathway to the thyroid gland into the neck. And so the thyroid gland, it starts in this little area whenever they're in fetal development, and then it moves down until it's in that bow tie, that thyroid, you know, that looks like a butterfly, your thyroid gland. See, there's a pretty picture of it. So here's your foramen cecum right here at the base of the tongue. Here's, you know, your lingual thyroid here. And then it gradually, as you develop through development, it goes past the hyoid bone, and then it turns into a cervical thyroid until it ends up being that nice normal positioning of the thyroid, and it turns into that pyramidal thyroid. Any questions about this? No? this is on page 51 as well. Here is your ankyloglossia. So do you see how that lingual frenum is almost attached to the tip of the tongue? So it's like that person that won't be able to stick their tongue out very far, or if they try to stick their tongue out, the tongue almost flares to the side and that middle part pulls back. They are, it is called tongue tie, and it's where it is attached closer to the apex of the tongue or the tip of the tongue. Dentists love to buy lasers and snip everything they possibly can with them. So this is a big thing to that they go through, and in most cases, if children are having, again, babies are having failure to thrive because of the fact that they can't get a nice sucking, whether it's breastfeeding or bottle feeding, they're going to have a problem. And so it is necessary to get this clipped pretty early because of the fact that the sucking motion would be healthier for the child. I'm personally not big on it for everywhere in the mouth, but and I've talked to several different orthodontists, and it's because of scar tissue. I know one of the big things that parents, I got kicked out of a mom's group one time because of the fact that I said that I didn't agree with it, because they wanted to, if you look in 10 babies' mouths, like babies before they have teeth, like they all have that frenum, that attachment, and it's because they're still growing, things are still moving and elongating, right? And so parents rush off and, they want to get everything clipped, like just clip everything. And orthodontists have said that it's not a good idea because you end up with scar tissue. And if you can end up with like a permanent diastema or a space in between your front teeth if you cut that too early. And even with orthodontics, you pull it together, scar tissue beats, it's physics, right? You have that scar tissue there, it's not going to come together, it's going to pop back open. So there's that's just my personal view. That's my expertise as a, but I've asked several different orthodontists and several different dentists, pediatric dentists, and there's no definite science behind it, but everyone wants to clip it. So yeah, let's see, I don't feel like I didn't say that. Let me go back. It's not on there. All right, on page 51 in your book, in the second paragraph on the right side, it says, the circumvallate and the foliate lingual papilla appear first, close to the terminal branches of the glossopharyngeal nerve or the 9th cranial nerve. Does everybody see that in your book? Okay. The fungiform lingual papilla appear later near the terminalis of the chordae tympani branches of the facial nerve or the 7th cranial nerve. Finally, the filiform lingual papilla develop during the early fetal period, which comprises the 10th and 11th weeks. So that is highlighted, therefore, I didn't see it on a slide, so I may want to make sure that you know that. Abnormalities of the tongue are uncommon. Nope, they're uncommon. One type of the more common is ankyloglossia, which is tongue-tied. I already discussed that. And it may be associated with other craniofacial abnormalities. So most of the time it's not just, they could have other issues. A tight lingual frenum usually stretches with time and with use, but if it's not adjusted over time with the movement, it's still non-functional. Oral myofunctional therapy may be an attempt to get that to do well, or then the surgical cutting. Those are, it's not the run off and do it just because, it's wise to wait. Unless there's any questions about chapter 5.
I have a question about the exam.
Yes.
So it's chapters 3 through 6?
Yep.
Okay.
Yep. So for obviously 5 and 6 are recorded right here. I'll make 2 quick videos for 3 and 4. Hopefully I will get to that tonight, so that you can have it all weekend to review over it. But pretty much everything I said in class, I mean, I suggest that the way that I suggest to study for my class is to follow along in the book, because pretty much everything I teach is straight out of the book. I try not to make it tricky for you. I do try to give you like real life scenarios that I have experienced or that maybe someone else has experienced, just because it makes it more real life, I feel like, for you, instead of just blah, 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 what the book says. But if, what I suggest is if you highlight what I'm saying in the book and follow along with me in the book, because I pretty much, slideshow goes this way. And then like I was a writer of notes, like I had to write, and if I wrote them, it sunk in a little better. This stuff is more memory based, but it also is, it's memory based, but it's also, you need to know it. Like, does that make, like, it's not just like, it's not like anatomy and physiology. Yeah, you did it, you passed it, you moved on. This is the very foundation of what you're going to be doing for the rest of your life. So I suggest that, like, go back, like, if you just look over everything that I have discussed or everything I have hit on, and I know it seems like everything in the book, but like if you're reading before the pretest and then you're listening to me in class, you're getting it both yourself and then you're getting it audio from me. I don't want you to have to write notes in class. That's the other thing, because I feel like if you're writing notes, you're not really listening to me. You're more focused on something else, right? So if you're highlighting, it's a little more, and then go back and write them. And then I suggest, because I've suggested this in all of my classes, that if you read through everything everything I say to you, every night, just a little bit before, it's going to sink in a little bit more. Like, I wasn't the best studier in school, but, and I tell everyone that I passed my national board with an 80%, and now I'm teaching you, but, I passed, and that is what is important. So, and I do love what I do, and I spend a lot of time learning more so that I can be better at it. So, I'm going to see if I can find that. Let's see if I can find that cool picture that was. Any other questions? Anything else that?
Yeah, I just want to ask if is the exam going to be online? Like, since on Monday is going to be, I think, holiday or something.
So yes, Monday is a holiday. So the exam for this week will be on Wednesday.
Okay.
In class, which is going to be online because we're not meeting on Monday. And so it will be on Canvas, but all other exams will be on paper in the classroom, not on the computer.
So I want to understand that it's going to be on Wednesday in school, correct? The exam.
Well, yeah, but we're not meeting in person on Wednesday. We meet online on Wednesday.
Oh, so we have to do it on Canvas.
Yes. So one thing that I suggest for students when they're taking a test on Canvas is to have a scratch sheet of paper next to you and write, like, if it's A, B, C, D, E for each question. And process of elimination, a lot of these quizzes, like, there's a right answer. And even if it's like a close two, there's always two that are not, right? So really focus on, like, if you're doing the reading and you're listening to me in class, you're paying attention, you really should be fine. But Wednesday, because we don't physically meet this week, because both days that we're having class, Wednesday and Friday, you have communications online in the morning, and I need to give you two, like, some of you, it takes a long time to get to campus. And so as much as I would love to give you your test in Canvas and to meet with you guys this week, it's just not feasible for any of us. So, and I'm not going to make you drive up there just to spend an hour there to take a test for me. Like, we'll just take it online. It's going to be honor system, please, please, please. I can now, I mean, I'm sure other professors have told you this, but like, you can get flagged from EA if you leave the site while you're taking the test. So it's highly recommended that you don't leave the Canvas site while you're taking the test, because we can see if you've left the test. And so, so that's one thing. I'll have you sit on your book. I know that sounds silly, but I'll have you show it to me and then you'll sit on it so that I know you're not looking through your book. It's the little things. Other professors will make you put your camera and face your screen. I'm not going to make you do that. Like, if you choose to cheat, you are eventually going to fail yourself, not me. I'm not going, you know, it's because you're not learning the material. That's the way I feel about it. Yeah.
So on Mondays, when we normally do take our exam on campus, we have class after that. It's not like take the exam and then leave.
Girl, we have to meet for 5 hours. Nope.
All right.
No, it is that's why I chose Mondays for exam day. So we will meet on Monday, and that'll be the day, the following Monday. So let's talk about June 7th, because next week is a wash. June 7th, we will meet. Your homework from your textbook or your workbook is due that day. Your second drawings, I think, are due that day. Other students have already turned in drawings. If you want to knock them out this weekend because you got time, knock them out. That is up to you. There's no rhyme or, you know, the only thing that, and if you want to do more pages in your book and I mark you off for it, I don't mind you doing that either. There's no set, it's, you know, just do the homework. This is, you know, I understand that some of the homework is, you know, maybe 15 points or, you know, or 15% of your grade or 10% of your grade. But if you make a 100% on those homeworks, that just because you've done it, it's going to help you if you don't do well on your exams, right? So it's going to help you. So that's 7th. So you'll turn in your drawings, you'll turn in your workbook. While your workbook is turned into me and I'm going through them and make sure that you did them, you will be taking your quiz. It'll be on paper, 50 questions, just like the first quiz that will be on Wednesday. And then we'll take a break after the test, and then we'll come back. I'll have a couple of you guys do, because your presentation is due on that day. I'll have a couple of groups do it that day, and then I'll have a couple of groups do it the following Monday. And then I will lecture on chapters, I don't know, I think we start to really get into our teeth, our enamel and stuff like that 3rd week. And then also we'll do a mid-mod assessment, because you'll have 2 tests. You'll have, after you do your second test, we'll talk about like making sure, and you're, you know, what you're doing, how your tests are. You know, I like to be real personal and know how you're doing, what you're doing, what I could be doing differently. I love feedback. Please tell me, Mrs. Calhoun, you absolutely suck at this. You need to change this. I will accept it and I will figure out a way to make it better. But I can't teach for just one student. That's another thing. I have to teach for the majority. And so I try my best to make it to where it's inclusive for everyone. Kind of got off on a tangent there. I do that on occasion. Let's see. And then I'll lecture after we do a couple of them. You know, everyone should be prepared to do their presentations on the 7th. Depending on how time goes, you know, maybe we'll knock all of them out, because there's not that many, because it's not a big class. And they're only 5 minutes apiece, and we have 5 hours, so we have plenty of time. But like I said, Bree, I would prefer to get most of my teaching done on Monday, so that our time together on Friday can be, or our time together on Wednesday can be minimal. Okay, I would rather have the interaction in school than to be on this silly, stupid Zoom. I don't like it. Yes, ma'am.
So chapter 3 through chapter 6 workbook and the teeth drawing has to be submitted via online?
Just the tooth drawing. Just the tooth drawing needs to be submitted on Monday. I week 1 and week 2, or module 1 and 2 workbook will be due on the 7th.
No, that's not what I mean. Like the
Okay.
chapter 3 through 6 that we have done on the workbook, is it going to be submitted like through, like we upload the file?
No.
So we have to bring it on the 7th to school.
Yes. Because on the 7th, you'll also have chapters 9 through 11, I think. 9, 10, 11. Is it 9 through 11 or 9 through 12? Let me see.
I think it's 11.
Yeah, because NAML starts, yeah, so it's 9, 10, and 11, right. And then, so when you come in on the 7th, have your workbook pages done for 3, 4, 5, 9, 10, and 11.
So okay, then for the first drawing for the tooth, will that be uploaded or?
Yes, that will be uploaded. And I put in Canvas, there is a link in Canvas for you to, there's a Word document that you have to fill out to grade yourself. If you could fill that out in a Word document and upload that with it, so that that's where I can grade it and send you back that grade very easily. Okay, just take a picture of it. Ask Devin, he did a great job. So if you have any, just take a picture of it and upload it. Or if you have a scanner, scan it and upload it. It's like, I really just want to see that you did it.
Okay.
And like, your teeth are very close to what you, like I had a student last term that she knew her drawings were bad. She didn't care. She gave herself 1s on everything. But I mean, like, as long as you put forth some effort, you're gonna, it's like I said, give it your best shot. I'm not asking you to be Picasso, so.
Thank you.
Because I'm not. You saw my drawings on the chalkboard or on the board, so. Yes, and here, let me pull up Canvas real quick because I'll show you. I try to have everything very organized, so there's really no big questions. Okay, so here is the student Canvas. If you come, so first of all, let's go with, here's your tooth drawing directions if you need them. Tooth drawing evaluation page. If you click on that, click on this picture, and then you'll get this is the evaluation. So you fill it out and then just upload it with your pictures, okay? Go back to modules. If you go to week 1 overview, because week 2 should have opened today. It has all your objectives, and then it has your to-do list for what is due. And I think your pre-quiz this week is not due until, and I have to check that or change that because I have to make the quiz real quick. But when your initial post is, there's no responses, but and then when your portfolio work is due for this week. So you see this is, or your workbook work. It's due June 7th instead of, what is that, May 30th? Is that what Monday is, or the 31st? I can't ever remember, 31st. Does this help make, I try to keep everything pretty much, here's your to-do list. This is what you need to do. And then I pretty much give you your reading, what should be done for your reading. And then what I'll be doing, your Zoom links and things like that. So your discussion, and you guys did great with your discussion. I know it was straight out of the book, but that's the way it's supposed to be. So it's just to give you that thought process of what's going on. Would anyone like to go take a 10-minute break, and then we will reconvene to do chapter 6 and then get the heck out of here on this Friday? Because I got my IRB approval and there's a bottle of wine over there waiting for me to open it up. So I get to put my thesis questionnaire out there on Facebook. So woo! All right, go take a 10-minute break. Mm. Okay. Let me get up my PowerPoint. Okay, so I have this lecture already basically uploaded on, so I'll send you the Zoom link. I also just worked on Canvas while we were on the break. I switched it to the days everything is due. So when you look at module 2, you'll see that on June, and I'm giving you Monday off. So make sure that you have your pre-quiz due by, or turned in by Tuesday before class on Wednesday. Make sure that you have your tooth drawing, for that week is not due till the 7th. Your workbook is not due till the 7th. And then your discussion post, make sure you put your discussion post in by Monday as well, or Tuesday as well, okay? All right, so let's pull out the good old book here and talk about tooth development. I'm going to, this is, like I said, this is kind of a bigger chapter. So there are two. Okay, Courtney, thank you for letting me know. Okay. All right, so. All right, so odontogenesis is the process of tooth development. Odonto being teeth, genesis being the development of, right? It is important that we understand the different stages of odontogenesis and the physiological basis of each stage. Developmental disturbances can occur when we during these stages, and you are probably all learning about that because of, you're doing your developmental disturbances, right? You're amylogenesis imperfecta, or they'll be learning about these different stages that's when this happens. All right. All right. Okay. All right. So this is a great picture in your book. It talks about all the different stages of tooth development. It starts with your initiation phase, your bell stage, your cap stage, your bud stage, cap stage, bell stage, appositional, and maturation. We are going to talk very deeply about each one of these sections because, like I said, this is a part that will be when you'll learn it now, and then when you come and do board review before you take your board exam, they'll refresh your memory with all of this, right? So dentition is the term that we use to describe the natural teeth in the jaws. So there are two dentitions. There are primary dentition and permanent dentition. Sometimes they call primary deciduous dentition. Your primary dentition starts, it's your baby teeth, and there are 20 teeth in total. And then in your permanent dentition, there are 32. Okay. The 20 primary dentition or deciduous teeth develop during the prenatal period. And then, like I said, they consist of 20 teeth, 10 teeth on the top, 10 teeth on the bottom, which erupt, and then they later shed. The 20 teeth that are already, that are your primary dentition have what is called a succedaneous tooth. And that means that it is while the baby tooth is developing, you also have this permanent tooth developing. So there are 20 succedaneous teeth, and there are 12 non-succedaneous teeth. Can anybody just guess for me which 12 teeth are your non-succedaneous teeth?
your second and third molars and your, I want to say it's one of the premolars.
Close, you got two. You said second and third. What about that first?
Kids have first molars though, don't they? Or at
Does the-
12, they get their first
Does-
molar.
At 6, they get their first permanent
Oh,
molar.
gotcha. Mhm,
So you got your 6-year-old molar,
mhm.
you've got your 12-year-old molar, or your first molar, second molar, and then your wisdom tooth, which is your third molar. Your baby molars, your first primary molar and your second primary molar, those fall out and you get your premolars or your bicuspids. Okay. All right. Great try though. Thanks, Bree. As the primary teeth shed, the jaws grow and mature, and then the permanent dentition consists of 32 teeth, like I said. They gradually erupt and replace, 20 of them gradually replace the primary dentition. Okay, so make sure I'm on the right track. Yes, odontogenesis is a continuous process until it's completed, and there's no clear-cut beginning or end point between the two stages. And like I said, it takes place in stages which occur in a sequential fashion for both dentitions. However, the stages are used to help focus on the different events in the odontogenesis and are based mostly on the shape of the developing structure. So odontogenesis of the primary dentition begins between 6th and 7th week of prenatal development during that embryonic phase, right? Because 6 and 7 is still inside that embryonic phase. Hold on. Excuse me. Excuse me, I'm sorry. Apparently I put nothing in Canvas for the process of care class, but things are due. Whoops. That happens. Okay, all right, so, sorry. All right, no clear cut. These stages are used to help focus on the different events of odontogenesis and are based on the overall shape and development of the structures, like I said. Okay, so after initiation of odontogenesis, so after the beginnings of the formings of the teeth, the initial identifiable stages in tooth development include, like I said, so you start with that initiation. Once that initiation starts, you have your bud stage. So I always think of a little flower because it's like a little bud, and then the cap stage. And like in the video that I'll send you later, I do a whole drawing and you can make fun of me later. It's okay. Or while you're watching it, it's okay. You can laugh at me. And then the bell stage before getting to the appositional and the maturation. Odontogenesis then progresses into the appositional stage with the formation of the partially mineralized dental tissue types. That includes, so the apposition phase starts to grow the enamel, the dentin, and the cementum. And then finally, the maturation is for those structures through, those three structures continue to grow and mature. Let's see, so another great picture in your book on page 54, where it talks about like, so enamel comes from the enamel organ, which is the epithelial. The cells that make it are the ameloblasts, which is why you end up with amelogenesis imperfecta, the forming of the ameloblast, which is the enamel, right? And so that gets all messed up a little bit. So it's just like it all kinds of runs around. And so it talks about, like, this kind of goes through and talks like it's not vascular, it's not innervated, but the pulp chamber is, the alveolar process is. But we haven't, the pulp chamber is inside the dentin. So that's great picture though. All right, so Where am I? Oh no, we're still in tooth development. Okay. During the stages of odontogenesis, many physiological processes occur. The physiological processes include induction, proliferation, differentiation, morphogenesis, and maturation. These terms sound oddly familiar, don't they? We just talked about them in all of the other chapters, right? So, except for the induction process, many of these processes overlap and are somewhat continuous during odontogenesis. However, one individual process does tend to be predominant, and especially marking each stage of odontogenesis. So something happens in order to really get to that, to make it each stage. So you have your, yeah, I'm seeing this picture again, but we did talk about it in chapter 3. So, right. So our tooth development goes into the developmental process. Like I said, we have our induction, our proliferation, our differentiation, our morphogenesis, and our maturation. Teeth are developed in lobes, some of them. So our maxillary anteriors are 4 lobes. Our mandibular anteriors are also 4 lobes. Our canines are 4 lobes. And if you've ever seen a kid grow in their or if you remember having the eruption of your front teeth and they have those little bumps on the edge, those bumps are called mamelons, but they're also where they grow in these little lobes and they come together, and that's how you end up with, sometimes you have that like a little bit of a demarcation line in the facial, in the front surface of that front tooth, and it's because those lobes have fused together. So a little bit of blah blah blah. All right, so these are in your book. All right, so let's jump on over to the initiation stage. Yippee, yippee, yippee. So this is the first stage of tooth development and is known as the initiation stage. Remember this cute little guy over here with his, nasal placodes and his lens placodes and his developing brain and his octic placodes. Well, you're also going to have like these little, teeth placodes, or that's not what they call them, but dental placodes is what they call them, that are going to be forming here in a minute too. So these in the initiation stage involves the physiologic process of the induction, which is the active interaction between the embryonic tissue types. At the beginning of the 6th week, the embryo's stomadeum, or the primitive mouth, is lined by the ectoderm. Okay. Let's see. So you can see here, so you have this is your developing maxillary arch. Here's your stomadeum, your primitive mouth, your little mouth that's going in. And then you have your oral epithelial, which are these cells right here. And then you have your ectomesenchyme here, okay? The oral epithelium consists of 2 horseshoe-shaped bands of tissue at the surface of the stomadeum, 1 band for each future dental arch. So here is your band, and then here is your band. This is your developing time. So the developing where your teeth are going to be, right? So the ectoderm, the outer part, which is the ectoderm, gives rise to the oral epithelium. At the same time, deep to the forming oral epithelium there's the ectomesenchyme, which is derived from the neural crest cells. And let me see if I can new share. Let's see if I can find that. Yeah, let's go here. Okay. Is it on here? Let's see if I can find it. There's a really oh no, that's getting, let me see if I can go back to 6, because there was the neural crest cells, right? Hold on. That I thought was pretty cool because of the fact that it gave your, there's your proliferation, your morphogenesis, your maturation, your fusion. Right, first trimester. Where was it? Maybe this is it. Let's see if this, right, this is where it makes the mesenchyme. No, because you'll, here it is. So you start to get that, and then it'll make the neural crest, and here's your neural crest cells, your little green cells. So you get all those little, the neural crest cells, and those little neural crest cells are what help to develop the ectomesenchyme. So just to kind of bring it all together. Okay. Was that helpful? I don't know. Got to see it in a different way. Okay, so dental professionals need to consider the importance of neural crest cells in addition to assisting in the formation of the cranial sensory ganglia. They also differentiate to form most of the connective tissue of the head. So there's lots and lots of different connective tissues, like our dental lamina and our, not dental lamina, the lamina propria, which is what our little fibers that help to in rotation of the teeth that we'll learn more about in the, but those are all parts that are really important. So you'll see here, so here's your developing tongue, here is your dental lamina, and here, this is your ectomesenchyme of the developing mandible. Here is your oral epithelium, and you can see here, that is a very nice little dental placode that is about, that's the initial, right? That little dental placode is like excited and about to start turning into a tooth. During the latter part of the 7th week, the oral epithelium grows deeper, penetrating the ectomesenchyme, and is induced to produce an adjoining layer, which is called the dental lamina. So the oral epithelium grows deeper, and you can see that it's like, it was that thin little line at the top here. Now it's growing deeper. Your lamina dura is starting to produce. And then at this time, there's also your dental placode, like I showed you, that little, let me see if I can blow. I know I can't. Nope. I can't. Can you see the little hand when I move it here? Okay. So here you can see the cells are just a slightly lighter color, maybe a little bit longer, and that is your dental placode, just like your optic placodes for your ears, your lens placodes, and your nasal placodes for your nose. Like these things will all develop into something else, right? So. So the placodes forming within each dental lamina, which resemble morphologically as well as their molecular regulation, the placodes found during the development of other ectodermal organs, such as the lens, optic, and nasal placodes. Each dental placode consists of a plate-like thickening of epithelium associated with an underlying neural crest-derived mesenchyme, or the neuroectoderm. The neuroectoderm. So know what the lamina dura is. I mean, the dental lamina, know what the dental lamina is, which is the, starts in the latter part of the 7th week. It's the oral epithelium that grows deeper, penetrating into the ectomesenchyme, and is induced to produce an adjoining layer. And that's where the dental placode. So the dental lamina begins to form initially at the midline for both arches and progresses posteriorly. So it starts at the midline, which that's why we end up getting our front teeth first usually, and then it develops back. Does that make sense? Like usually the first teeth to erupt in a baby's mouth are your two lower ones. It's not always the case. There are some, rarities that it's a top front tooth or whatever, but in most cases it starts here at the midline and then that epithelial grows thicker and the dental, the little dental plaque starts to form. Okay. All right, clinical considerations. I know I'm going to go through this very quickly because of the fact that you guys are going to kind of go over this. This will obviously not be on the first test because of the fact that you guys are doing your presentations on them. And so I want you to be able to learn from each other in this. So it'll be probably on the second test. But your anodontia, does someone want to tell me what anodontia is? Give me a guess. Anodontia.
When you don't have any teeth.
Yep, where you're missing a tooth. Yep. It could be a tooth. It could be all of your teeth. It could be a few of your teeth. But anodontia is just a term for. Now, I did tell you guys, I told you guys a story about the ectodermal dysplasia the other day, right? Yeah. So those children or adults have anodontia because they're missing a tooth or some teeth. This is considered anodontia. This is an adult mouth. Obviously, you have your premolars here, your premolar and your permanent first molars, but they are missing so this would be a single tooth anodontia, right? And so, yeah, like this is perfect place for you to get some of that material from, is that it's the absence of, it could be a baby tooth or a permanent tooth. Does anybody know what the most common missing teeth are?
Is it the second premolar? First premolar?
It is, well, wisdom teeth are, the third molars are commonly missing. And then there are the lateral incisors. The maxillary lateral incisors are very commonly missing. Or they can be peg laterals where they end up forming misformed. Yeah, those are, and then I think premolar is the third one actually, but those are the three. Those are also the besides the lateral, like you can have extra molars, which is called the fourth molar, and then you can have extra premolars, and then you can have supernumerary, which is your extra front tooth. I had supernumerary, at a extra central incisor, and I had 6 wisdom teeth. So teeth were really my thing. This was God's plan. This had nothing to do with me. Me and my oral surgeon were like that at like 6. So here's, like I showed you that quick picture the other day. This is a person with ectodermal dysplasia. They don't have the tooth germ, so it doesn't originate. It doesn't happen. Supernumerary teeth, most common is right there in the central incisor. That's, you can tell that's an extra tooth. It's not as big as a central incisor. Mine was just like the crown. It wasn't anything big, but they took it out at 6. So, because it was blocking the permanent eruption. And as we learn a little bit more, the reason that they had to go in and surgically remove it for me was because my permanent tooth, when your teeth begin to erupt, half of the root is developed. So as it's erupting, the other half of the root is developing. Once a root is completely developed and the apex is closed, it will not erupt anymore. It will be logged in your mouth or in your head for the rest of your life, unless you surgically remove it. My wife just said that I did it, and I've been sitting down the whole time. I don't know how I did it. Side note, does anyone else get peer pressure to work out because of their watch? Yeah, it's a thing, peer pressure. I saw a meme like that today and it made me laugh. So so here you go. So the maxillary central incisor is a mesioden. Supernumerary, okay, so mesioden is supernumerary is the big picture, supernumerary extra teeth, right? The mesioden is the one that's in between your central incisors. And then you have your fourth molar, which is if it's with your wisdom teeth in the third molar area. And then if you have an extra one in a premolar, it's a perimolar. I've actually seen a patient who had premolars fully erupted in their mouth, and then they had a complete extra set down here, like a dang shark.
So I
But you
had a
see-
patient yesterday tell me that she had a whole second row of teeth behind her lowers, anteriors.
My guess is that her permanent teeth came in behind her baby teeth. Either that or she is a rarity.
Yeah, I
Because,
was
like-
like, what?
Yeah, well, because like you'll hear, like, I mean, how old was this person?
She was in her like 70s now.
See, I wonder
She
if
said
it
when
was
she
like,
was like a teenager or something.
I mean, maybe, you never know. You're
Yeah.
like, all right, we should write a book about you. But yeah, like that's, I get text messages, and you will too when you're a hygienist. I get text messages all the time from my friends that are like pictures of their kids' mouths, and they're like, is this normal? Like, well, yeah, just wiggle them, or you go get them taken out. I mean, so there's your supernumeraries. All right, so those are your things that can happen in your although the entire picture of them, of all of the different developmental disturbances or anomalies are on page 56 through 58. That is what can happen in your initiation stage. Now you have your little bud stage, right? So here's your cute little flower. See, I told you there'd be a little flower up there. Your bud stage is the second stage of odontogenesis, and it occurs at the beginning of the 8th week of prenatal development. It is named for the extensive proliferation of the dental lamina. So remember, here's these white cells of the dental lamina into buds. So this is when you start to actually be able to see that like kind of like the development of a tooth going on, like a little sac. So and it's 3-dimensional oval mass. So if you were to take a CT scan, you would see the 3-dimensional oval mass that penetrates into the ectomesenchyme. Again, here's the ectomesenchyme. Here's your developing alveolar process. Here's your oral epithelial, and it's kind of your oral epithelial here, and it kind of goes down and starts to form this little. At the end of the proliferation process involving the dental lamina, you will have 10 buds on the mandibular arch and on the maxillary arch. Okay, and this is going to form our primary set of teeth, right? So underlying the mesenchyme also undergoes proliferation, the ectomesenchyme, and the basement membrane remains between the dental lamina bud and the growing condensing ectomesenchyme. Let me see if I want to see if there's another, I know we're jumping back and forth, but these are your, nope, I want to go back. I want to go to the teeth, because I thought that this was, so see, like here's a permanent teeth, and they start to grow when these are in, but then they take time to come in. Let me see if I can, that's not the one. Okay, so here's your placode, here's your bud, there's your cap, and then there's your bell. So we'll get into a little bit more, but I like you get to see how it all processes. So yeah, we'll come back to this one in a minute, because this right here is a good picture to see. All right, let's see. All right, back to the bud stage. It says that up here, right? Okay. Let's see. Let's go to clinical considerations. things that can happen during the bud stage is macrodontia and microdontia. Can somebody tell me what macrodontia is?
And your teeth are larger than what they should be.
Yes. How about microdontia?
When they're smaller than what they should be.
I'm gonna start calling on y'all if Bree's the only one that's gonna answer me. All right, yes. So you have your macrodontia and you have your microdontia. Peg lateral is considered your microdontia. You also end up with your peg molar. Sometimes the third molars are a lot smaller. This is a great, I mean, you can see, like, look at the size of this molar. I mean, it's, you know, it's bigger. Or you have your little peg molar up here, right? You know, your, now we're in the cap stage. Okay, so the cap stage is the, let's see, yep. Is that all I had to say about that? Okay, real quick, going back, abnormally small teeth, microdontia, abnormally larger teeth is macrodontia. Know that a case of complete microdontia of either dentition rarely occurs, but can be associated with hypopituitarism or Down syndrome. So macrodontia is something that Down syndrome is a issue with some patients with Down syndrome, and you'll learn more about that in process of care. But that's just a, you know, that was highlighted, page 659. So I want to make sure I touched on that. Third stage of odontogenesis is the cap stage and occurs for the primary dentition between the 9th and 10th week of prenatal development in the fetal period. Okay, so we're that night, I think it's 9th week starts the fetal period, they say. Is that right? 2nd through 8th week is embryonic, and then the fetal is 9. So it finishes development, so it occurs in that 9th and 10th week, which is during that fetal period, that towards the end there. So it's, you can see here, you end up with like an enamel knot, and it's kind of like a little, you know, you've got your little enamel organ, your dental papilla, your sac, and then you've got like, you know, it's kind of like capped, like a, you know, the way I see it, it almost looks like a little mushroom and a little cap here. You can see this right here. So this is a baby tooth developing. This right here, this little piece over here is your successional dental lamina, which will end up being our succedaneous tooth. So I think it's always really neat that, like, if you look at it from, and there's a picture later on, if you look at it from another angle, you have your baby tooth growing, and then right here off the back, you have your permanent teeth starting to develop, as this one is. You know, it just amazes me that it happens all at the same time. Okay. All right. From these combined physiological processes, the depression results in the deepest part of each tooth bud of the dental lamina, forming the cap shape of the enamel organ. So here's that enamel organ, this white part here, right? And so it's got that cap shape where it's like on top of or around, like fitted on top, you know, you can kind of see that. In the future development, the enamel organ will produce enamel on the outer surface of the crown of the tooth. Let's see, and then we'll talk about the innermost margin of the cap shape of the enamel organ orchestrates the future crown form of the tooth, such as cusps. Specifically, this may occur through non-dividing cells in the enamel nut, which is here, present in the region of the developing posterior teeth. So this is present in the developing and posterior teeth, like it says, and it's that enamel nut that's back there that helps they're non-dividing cells. So it's there around that cap. A part of the ectomesenchyme deep to the buds has now condensed into a mass within the concavity of the cap of the enamel organ. So you have your knot, here's your enamel, your dental papilla here, here's your enamel organ, this white part. So this whole section, this, and this dental sac is all part of that tooth germ, okay? The inner mass of the ectomesenchyme is now considered the dental papilla. So you have your cap, you had your dental sac or your ectomesenchyme, right? And so it's that cap is starting to surround that ectomesenchyme, which is forming the dental papilla. All right. The dental papilla will produce the future dentin and the pulp of the inner part of the tooth. The basement membrane still exists as before, but now it is between the enamel organ, which is this part, and the enamel and the dental papilla. And it's the site of the dento-enamel junction. So it is where the dentin and the enamel will come together. Dentin being the inside of the tooth, the enamel being the outside. So this enamel organ is going to eventually turn into the enamel. Then they have this nice white line here, which is your where your dental, and then you have your dental papilla, and you're going to end up with that junction there because the dental papilla is going to turn into the dentin and the pulp. All right. Okay, yes, the remaining ectomesenchyme surrounding the outside of the cap of the enamel organ condenses into the enamel sac, the dental sac or the dental follicle. So this is the dental sac here. It's a lot, but like you can kind of see where it's all kind of happening. And like I have that little book that I told you that has a little video of how it all works. So that'll be nice too. All right, in future development, the capsule-like dental sac will produce the periodontium, the supporting tissues of the tooth, including the cementum, which covers the root, the periodontal ligament, which attaches the cementum to the bone, and the alveolar process, which is the actual bone that teeth sit in. Okay. All right. Similar basement membrane also separates the enamel organ and the dental sac. Okay. All right, let's see. At the end of the cap stage, these three embryonic structures, the enamel organ, the dental papilla, and the dental sac, are now considered what is called the tooth germ. So you have your enamel organ, your dental papilla. You see how it's like that enamel organ is that cap around there. Then you have your inner enamel epithelium here. This is a top tooth because remember, this is the mandible. This is the maxilla up here. And so here's your oral epithelium, here's your little tooth. And so that whole thing is called a tooth germ, which is the primordium of a tooth. So tooth germ will eventually become the tooth, just like the stomadeum is the primordium, the primordial mouth, right? So, or the primitive mouth. All right, so to break it down into a very nice table, the enamel organ, which is the formation of tooth bud in the cap shape with a deep central depression, will form the enamel. The dental papilla, which is a condensed mass of the ectomesenchyme within the concavity of the enamel organ, will turn into the pulp and the pulp and the dentin. So if you know what a tooth looks like, you have your enamel layer on the outside, right? You have your dentin and your pulp on the inside, okay? And then your dental sac will become the part that we don't see, right? We'll cover the cementum. It's the condensing mass of ectomesenchyme that surrounds the enamel organ, and it will turn into the cementum, which covers the root of the tooth, the periodontal ligament, like I said, that is the structures that go from the cement to the alveolar process, and the alveolar from the cementum to the alveolar process, and the alveolar process is the bone that our actual teeth sit in. All right, this is that picture I was telling you about that I think is kind of a neat picture to see. So you can see that these little pink spots are your succedaneous teeth. here is your developing primary tooth, and here's your succedaneous tooth, your developing permanent tooth. And you can see the stages that it's in. You know, we're getting, this is about to be into the bell stage, not the cap stage anymore, but it is a developing tooth. Here's your mandible, right? And your tooth is going to sit in what is called the alveolar process. You have your developing arch. This is, you know, that your tissue there. Here's your lip. There's your body of the tongue. And this is, you know, this is the body of the tongue, and this is the base of the tongue. So this would be like if you were cut, like this part of your jaw was missing, right? And you were looking at it from here. Okay. Okay, so, yeah, all right, so, permanent teeth, okay, this one. Permanent teeth formed with primary predecessors are considered succedaneous and include the anterior teeth and the premolars, and include which replace the primary anterior teeth and the molars respectively, right? So your baby teeth are, you have 4 anterior teeth, your centrals and your laterals, then you have your canines, and then you have your baby molars. All of your premolars, your canine, and your incisors are all succedaneous. Your, like I said earlier, first molars, which come in at around 6, your 12-year-old molars, which are your second molars, and your wisdom teeth are all non-succedaneous. And that kind of, in contrast, the permanent molars are non-succedaneous and have no primary predecessors. Instead, the 6 permanent molars per dental arch, so 12 total, develop from the posterior extension of the dental lamina, distal to the dental lamina of the primary second molars, and its associated mesenchyme in each quadrant. So remember, we start with the development here, and it trickles back until, you know, everything is done, and then it starts to develop, you know, then they start to develop the teeth after that. So, you can see there's your little mecal cartilage. Here's your palatal shelf again. Here's your mandibular bone. I don't know why this picture is in here. I don't even see it in your book, but we're gonna skip because I would think that maybe if they were trying to show something, but you can't really, yeah, okay. Developmental disturbances of the cap stage. You can get dens and dentae, which is a tooth within a tooth. That's what it means. It's where you get abnormal invagination of the growth of the dental papilla. You can see that you start to grow a tooth inside of a tooth. Like I said, I'm just going to name these, right? Gemination is another thing that happens. And we'll learn about more of that on the 7th. Why it's called gemination. Then there's fusion, can also occur with teeth. You can see that it looks like 2 teeth, where gemination is one pulp, which looks like 2 teeth, right? That develop, but they say that they have the same pulp, whereas fusion is 2 teeth that are fused together and they have 2 distinct pulps. Sometimes you can't tell this most of the time you really can't tell this without an x-ray. And then your tubercle, which is a extension or an extra cusp that you, sometimes get on teeth. So you can see this premolar has an extra cusp. All right. Bell stage is the 4th stage of odontogenesis. It occurs for the primary dentition between 11 and 12 weeks of prenatal development, which is in the fetal period. You can see that these cells start to get different. There's stellate reticulum, the stratum intermedium, and then you have your inner epithelium, you have your outer epithelium. your outer epithelium and then your inner epithelium. And then your basement membrane is right along the side here. These are your central cells of the dental papilla. So here's your dental papilla. You can see it's starting to look like a bell, right? It is characterized by the continuation of the ongoing processes of proliferation, differentiation, and morphogenesis. Differentiation occurs on all levels, occurs in its furthest extent, and as a result, 4 different types of cells are now found within the enamel organ. So in the enamel organ, you have your stellate reticulum, you have your stratum intermedium, you have your inner enamel epithelium. So you end up with a lot more. You have, the cells that the outer epithelium, enamel epithelium, the stellate reticulum, the stratum intermedium, and your interenamel epithelium. So inner being on this side, outer being on this side, inner being closer to that lamina and dental papilla. Okay, let's see. Like I said, you can read this. See where is in future development, the outer cells of the dental papilla will differentiate into dentin-secreting cells, odontoblasts, whereas the central cells of the dental papilla become the primordium of the pulp. So the outer cells of the dental papilla will become will differentiate into dentin-secreting cells, which are odontoblasts, which give us our dentin. And then the central cells of the dental papilla become the pulp. So here are your differentiated cells of the dental papilla, and then your central cells, I don't see them, but will turn into the pulp. All right. The appositional phase. Lots of growth happens here. And we're gonna kind of, appositional is the final stages of odontogenesis. We start to get our enamel matrix forming here. And then the final stage is the maturation, which is reached when the matrices of the hard dental tissue subsequently fully mineralize. So that's the full maturation phase. All right. So coronal enamel and dentin production. All right, so tooth development begins in the crown and then proceeds to the root. So the way the tooth develops is it's almost like masonry. Like you start and it builds and it lays on each other. That's why if you've ever seen like someone with like, I don't know, like fluorosis, or like you could see like almost like a line of demarcation, almost like if you had like rock, sometimes when you see the way the different types of rock has formed, you have like your sedimentary rock, and then you can see almost like a line when it, like the different types of rock formation. Enamel does the same thing. So if there is a, if you're laying enamel and it starts at the cusp and then it grows into the root, but if you are halfway through the development of a tooth and you spike a really high fever, sometimes that can show in the middle of the way the enamel is laid. Even during prenatal development, if you are pregnant, like, and you spike a high fever, you can cause a discrepancy in the way the enamel is laid. Like there could be a pit there, and there's no rhyme or reason to it, but we can't pinpoint it, but it's interesting that all that can happen. So it's like a complicated dance between producing cells and their respective matrices. Okay, so after the formation of the inner enamel epithelium, so that's this, you have your enamel matrix up here, which is your enamel organ, which is your stellate reticulum, which looks like stellate reticulum, which looks like a little star. That's the way I remember it. And then your stratum intermedium, which are these like long pink ones. Then you have your inner enamel epithelium, and then you have your dental papilla. Okay, and so there's a basement membrane right in there in the middle there. So this is your whole enamel organ, and this is your dental papilla. And so as you're starting to form those preamyloblasts, you can see that the inner enamel epithelium starts to become more columnar. So it becomes and starts to elongate and differentiate. And when it differentiates, the cells, the nucleus go to one side, right? So, and this forms the this growth and elongation of the squares, the inner enamel epithelium, gives rise to the preamyloblast, which will give rise to our enamel. Okay. They line up along that basement membrane, and during the differentiation process, the nucleus of each cell moves away from the center of the cell to the furthest position away from the basement membrane. So it moves to one side. This movement of the nuclei is called repolarization. The future development of amyloblast will induce the dental papilla cells to differentiate into dental forming cells, or odontoblasts, and then themselves they'll differentiate to secrete enamel or amyloblast. So, I mean, preamyloblast would probably turn into amyloblast. I mean, it just kind of makes sense, right? After the inner enamel epithelium differentiates into those amyloblasts, the outer cells of the dental papilla are induced by the preamyloblast to differentiate into the odontoblasts, like I said a few minutes ago. And see, those odontoblasts do the same thing. They are stretching out and repolarizing rather than just being this line here, right? And so then this basement membrane, because it's pulling apart from one, that basement membrane starts to get thicker. So that thickness of the basement membrane turns into the predentin. And then got that, talked about the odontoblast. And then, like I said, the odontoblasts go through repolarization as well, because again, the cells are pulling away from that basement membrane. And as I said, they pull. After the differentiation and the repolarization, the odontoblasts begin dentinogenesis, the growing of dentin, right? The appositional growth of the dental matrix, or predentin, which is this yellow stuff right here in the middle here, laying down on their side to now disintegrate the basement membrane. So they're together, there's a thin basement membrane, and then like they kind of start to pull apart, repolarize, and they form that predentin. All right. Let's see. So you can see this is a nice picture. Here is your predentin, this blue stuff. You can see how these cells have all repolarized, these amyloblasts, and you see all the nucleus are away from that basement membrane. And then we have our odontoblasts, which are doing the same thing. Those cells are pulled away. And then our the dental papilla that's down here, the rest of it is just kind of turning into what is going to be our pulp chamber, because the pulp is going to be in the middle, and then our enamel is going to be on the outside. And so this is that big formation. So you can see here, your dentin is here. Let me make sure that because it's not, where's this picture in the 13.2? Oh, figure 13.2, not even the chapter we're on, but it's a good picture. Okay, yeah, I just wanted to make sure. Makes sense, but here is your predentin here. Here is your dentin here. And then your little arrows are pointing towards the odontoblasts. So these are your odontoblasts. All right, so your ameloblast starts to make these little, because like remember, the odontoblasts are pulling away. It's making that predentin. And you can see these little odontoblastic process, where these little dentin, like these little tubules that go through, and these are your odontoblasts that are forming this predentin here. And then at the same time, our ameloblasts starts to produce these little tomes processes. And the tomes process is like this little arrow. And I just kind of imagine like it's pulling away and the little arrow is just like spitting out enamel, the enamel matrix. And so your enamel matrix, like I said, it's laying in this formation, and it's, you know, layering, like, you know, they're all just spitting out this little enamel matrix. I mean, it's maybe not the most, you know, technical term, but I think, you know, it can be seen right there. So know that the tomes process secrete the enamel matrix and form that, take one of my headphones out real quick, to form that enamel. Can you guys still hear me? Okay. I'm trying to move as fast as I can. This is, let's see, disturbances. Okay. Wait, did I jump? Nope. After differentiation, is that amyloblast? Yep. Talked about the TEMS fibers. Yes. Okay. The dentino-enamel junction, you know, you can see that on, like if you look at a radiograph, you can see where the dentin and the enamel meet. That's your dento-enamel junction. It's not rocket science. It's where the dentin and the enamel meet, right? So here you go. Here's a perfect example. Here's your enamel here. Your yellow part is the dentin. So this line right here would be your dento-enamel junction, okay? Your pulp is in the middle. This is where all your blood vessels come from. Here are all kinds of little fibers. This is your alveolar process. And
Headphones. All right, can you guys hear me? Okay, it switched over. My headphones said, you've had them in too long. All right, next. All right. So disturbances. Why didn't it jump? Oh, we haven't gotten, okay. So, you know, as I said before, you can see here's your dentin, here's your odontoblast. This red part is your enamel, and these are your ameloblasts. Your ameloblasts are laying your enamel, your odontoblasts are laying your dentin. Therefore, you end up with your dento-enamel junction here. Okay? And your ameloblasts will disintegrate with tooth formation. All right, so enamel dysplasia is one disturbance that happens during the appositional phase. It just makes sense that that would happen because of the fact that what are we doing in that phase? We're laying the enamel, right? So there is localized enamel dysplasia where it could happen from trauma of knocking a tooth or a fever or high dosage of antibiotics, you know, at a certain point. And then there's systemic, and that's where it could be from an infection like syphilis or because you get that enamel growth that's wrong, or dental fluorosis from systemic fluoride levels, those type of things. You have enamel hypoplasia, and it does not turn your teeth red. This is tooth dye from, like, you know, you're checking for your plaque levels. But what it's here to show you is you might not be able to see it if they didn't have this red on there because of the fact that enamel hypoplasia causes pitting in the enamel. And so or grooves in the enamel. And I mean, again, think about it. This is enamel hypoplasia would happen during the formation of enamel, which is happening during the appositional growth, right? I'm gonna, again, let you guys really teach me about these different abnormalities. And I think we talked about last week with the Mulberry molars and the Hutchinson's incisors as well. But enamel hypocalcification, it's where you get that a really white, opaque, or yellow-brown intrinsic staining, so inside the tooth, but it happens during the maturation of enamel. And then dental fluorosis is the inner. It causes a mottling of the enamel, and it's due to excessive fluoride use. Fluoride ingestion. So depending on where you live, no matter if you use well water or city water, there's probably fluoride in your water. If you live in Maryland, there are 3 aquifers that the water supply in this state provides water. And especially in the Southern Maryland region, like from where school is south, I know this. Baltimore uses the Patapsco as well. But a lot of them already have naturally occurring fluoride in their water system. If you live close to the coast, you usually have a much higher level of fluoride in your water system. So like the Eastern Shore has higher levels. Like drinking tap water on the Eastern Shore might not be the best thing. It might give dental fluorosis. They're super hard teeth. They just don't look pretty. Amelogenesis imperfecta, again, it's something that happens in the amelogenesis process. So, and dentin dysplasia, again, happens in the, to the dentin. You guys, a lot of you guys are going to be going over these things, and then I'll really touch on the ones that you guys don't, which I probably should have thought about today. This week has been crazy, but, and then let me see what we have for our next. Stop the share. We went through that pretty quickly, which I'm really grateful for, but, all right. And then the second half of this is root development. That's right. Okay. Okay. All right, let's see. When I do this, I lose you guys. Well, there you are. All right. Let's screen share and go to this little guy real quick before we. So, here is, like I said, this is your Bell stage. You have your outer enamel epithelium and your inner enamel epithelium. Okay. And then this is when you have your stellate reticulum, and then your stratum intermedium, which is your, not the little star-shaped ones. I just think, like I said, again, I think that it gives a really much better, like the odontoblasts start to differentiate. They make those you start to get your dentin, and then your ameloblasts are doing the same thing. They're signaling, and then they start, and here's your enamel and your dentin. Again, you guys feel free to have fun with this as much as you'd like, but let's see. Yeah, here's the this is more of that root development, that tooth eruption. Really, yep. Okay, so close out there, come back up here. Oh, pause, stop. Okay, all right. Let's fix tooth development and eruption part 1. Yeah, no, I don't want part 1. Where's part 2? There it is. Oh, hold on. Oh, this lady and her technical difficulties. It's unbelievable. There we go. Okay. Like I said, I'm totally hitting on the highlighted parts. So here we go. You guys can read the rest if you so feel fit. I would hope so. All right, so the structure responsible for root development is called the cervical loop. The cervical loop is the most cervical part of the enamel organ. a bilayer rim that consists of of only the inner enamel epithelium and the outer enamel epithelium. And then to form the root region, the cervical loop begins to grow deeper into the surrounding ectomesenchyme of the dental sac, elongating and moving away from the newly completed crown. So the crown is developing with the enamel matrix, and then it starts to remember you have your inner enamel epithelium and your outer, and it kind of comes together in that in that bell stage where it's right here. Well, it starts to come together, the outer and the inner and the outer, and it comes together and it forms what is called the Herwig's epithelial root sheath, or the HERS tissue. And this is what eventually forms the root. And you'll let me see if I can, this is the picture that I think does it all the justice in the world, is these two. So we'll start with this one. You can see here that you start to get your dental sac, you have your enamel matrix, you have your enamel starting to lay this blue stuff here. And you have this green, like what is your inner and your outer enamel epithelium. And I feel like I'm looking at the screen up here, but I'm talking to you guys, right? I'm sorry. This is why I don't like it. But so you have your inner enamel epithelium here, your outer enamel epithelium here. And like I said, everything else is going on up here, and these two just kind of move along and keep going to form the root. Does that make sense? Okay, can you see that there? And then when I come here, this is that more, cellular level. So you have your dentin growing, and so here these two epithelial layers come together to form that root sheath. So, okay. Jumping over to page 70, under multi-rooted tooth development. So concrescence is the cementum. It's an overproduction of cementum that happens when we're growing that out of that enamel epithelium and the HERS fibers. So the multi-rooted tooth during the formation, let's see. During the formation of the enamel organ on a multi-rooted tooth, the elongation of the cervical loop, elongation of the cervical loop occurs, which allows the development of the long tongue-like horizontal extensions of flaps within it. So there's an image in the book. Let's see. You can see that it starts. So your tooth is laying. All this is the enamel, you see, and then it starts to continue. Your HERS are going up, and then where they're going to develop roots, whether it's going to be, your single rooted tooth or your double rooted tooth or your triple rooted tooth, right? So this is what a single rooted tooth would look like anyway, and this would be your double, and this would be your triple. Where this is just trying to see what you guys know and what you don't. Multi-rooted tooth. Which teeth have two roots?
The mandibular molars.
Mandibular.
Molars.
Yes. What about which teeth have three roots?
Maxillary molars.
Okay, very good job, Amanda. So yeah, the way that I like to say it is that there's the top teeth, the maxillary molars have three because they have to hang on, whereas the bottom just have to stand up. Does that make sense? Helps to kind of remember those things. Okay. All right. So, yep. All right, got that. primary teeth and shedding. Oh, your enamel pearl, that's the, it's a, where a piece of enamel kind of gets lodged into your cementum. Enamel production. Dilaceration is just a bend in the root. These are some pretty cool ones. This one's really out to have a good time. That one. These are just happy. All right. Okay, so accessory root. Oh, primary tooth and shedding. That's where I'm going. Haha, there we go. All right, so external cells. So our teeth are the actual movement of teeth is active eruption, and passive eruption occurs with age when our gingival tissue recedes and it uncovers the cervical root. But like our teeth are always kind of in a passive eruption. They're always like, they can always move. It just kind of happens that way. The active eruption, yep, that's it. Or no, where am I looking for that? Oh, there it is. Boom. All right. Trying to make sure that you guys have the information that you need to have for the sorry, you guys, I'm just looking for the information to give to you guys so you can see it. Oh yeah, where's that? They do talk about the tooth fairy in here. Yep. Okay. So on page 72, it says external cells of the reduced enamel epithelium. So the layers of the enamel organ become compressed, which gives rise to the reduced enamel epithelium. So they start to thin out, like they get compressed, and it forms the REE, the reduced enamel epithelium. And it appears as a few layers of flattened cells overlaying the enamel surface. The external cells of the REE, or the reduced enamel epithelium, are mostly from the stratum intermedium, but they also include cellular remnants of the stellate reticulum and the outer enamel epithelium. Thus, these undifferentiated epithelial cells will divide and multiply and eventually give rise to the junctional epithelium of the tooth. And the junctional epithelium is where when the dental hygienist is perioprobing and you go to the base of the pocket or the base of the sulcus, that is your junctional epithelium. That's where that epithelium meets the cemento-enamel junction and gives that nice pop, that cuff around our teeth. Does that make sense? Do you guys understand that? Yeah, okay. Like I couldn't find that anywhere. It was driving me nuts. So, okay. All right, so the process of shedding primary teeth is intermediate or tight/loose, because at the same time that the osteoclast differentiate to resorb the bone that makes your tooth fall out, the odontoclast differentiate to resorb dental tissue. And the always ready odontoblast and cementoblast work to replace the resorbed parts of the root, as well as the fibroblasts that repair the PDL. So if you've ever noticed that the primary tooth may become tightened just when you go over to start, or you take them to the dentist because you're like, this tooth is really loose and needs to come out. And it's like, no, it's not ready. Like, give it some time. And it's because our body's always trying to act against it, right? Like we're trying to, it's trying to like almost keep it in there until it's absolutely right. Like, you know, but I'm a tooth wiggler and I love to just pull kids' teeth out. It's so, you know, my kids do it all on their own though. So, you know, I hear teachers that are like, oh, I hate it when kids come to me with their snaggly tooth. Little kid walked down the other day, his tooth is all crooked because it's ready to come out. And I'm like, ooh, Jack, go get a tissue. I help you out. And he's like, no, Miss Calder, no, don't come by me with your, you know, it's gone now. So that's a good thing. If not, I held it. No, I'm kidding. All right, the permanent tooth eruption. So we have our little succedaneous tooth that is growing in behind the permanent tooth, right? And the process of eruption for the succedaneous permanent tooth is the same as for the primary tooth after the widening of the what's it called? Darn it, I'm losing my train of thought. The GC. It is the because I've spent too long trying to find that other one. The gubernacular canal. The gubernacular canal is what it's called. So the gubernacular canal is, I'll tell you what that is. The dental sac surrounding the succedaneous permanent tooth retains its connection with the lamina propria of the oral mucosa by means of a strand of fibrous cord, which is remnants of the dental lamina within the gubernacular canal. As the succedaneous permanent tooth begins to erupt, the gubernacular canal, that's just a silly word, I'm sorry, is widened rapidly by the osteoclast activity, removing the surrounding alveolar bone so that the tooth has a pathway to come in. Oh, yes, sorry. Yes, I can. I am so sorry. Okay, I think everybody's in now. I'm sorry. Okay, so that the shedding of the primary tooth, so the process of eruption of the succedaneous tooth is the same as the primary tooth after the gubernacular canal, like the reduced enamel epithelium fuses to the oral epithelium and then leaving the epithelial lined eruption canal for it to come through. That's kind of complicated to understand, but there is let me see if I can find that picture. Or was it before? There. So you have like that tissue disintegrates here and it starts, so because you can see here's your oral epithelium, here's your reduced enamel epithelium here, because like your everything starts to shrink down. You start to get the fusion of that tissue to your, you know, of the reduced enamel epithelium to the oral epithelium, and then the tissue disintegrates, and then the initial junctional epithelium kind of pulls back, and that tip of that tooth starts to erupt. And the same thing happens with the permanent tooth, except for it doesn't have to go, that tissue doesn't disintegrate so much depending on how long the tooth is there. Okay, let's see. Only a few more things. I think that has to be. That's it. That's it, folks. So this is that's the last thing that we need to know about for this chapter. And you can see here that like, here's your permanent teeth here, here's your baby teeth. And like I said, you need to have like about half of the root before it starts to erupt. Same thing down here with the maxillary. And then these are your tooth eruption patterns. We'll get into this a little bit more when we learn about each and every tooth and how they develop and when they develop and things like that. But these are always good charts to have and to look at. So, yep. All right. Let's see. Stop sharing. That's what I'm doing. Okay. Let me see about up here real quick. If there's anything, like I said, there's great summary of the dental tissues. There's a great in that chapter 8 of that book. There's a great chart that talks about the different parts of the different tissues of the teeth, like your enamel, your dentin, your pulp, your cementum, your periodontal ligament, and says what it's how it's let me just show you, makes it easier, like what it comes from, all of these, this everything that forms it. I mean, these type of things will be really, really great to keep track of for when you go to take your, for your board exam in the future. Actually, also a good resource for your presentation. So here's an oh, this is dilaceration, how the tooth, I was going to see if it had an illustration of the tooth eruption. Oh no, enamel development, but, and we'll get into that more in more detail next week. So when we get into the histology part of everything. Any questions for me before you guys go and enjoy your weekend? I tried my best to go as fast as I could and to hit it as much as I could. Yes, Miss Amanda.
Will these slides be
Yes.
posted? Or?
I'm gonna post them.
Okay.
Yeah. I mean, the slides are literally word for word out of the book. Yeah, that's why I don't read all of them. You don't need me to read you the book. You want me to tell you the highlights of the things that you will be tested on, right? That doesn't mean you don't need to know it. It just means that you're grown adults and you can take responsibility for your learning and read the book on your own, and you don't need me to read it for you or to you, right? Anything else?
Just for like clarification, you read us the important parts, like the things to really focus on for the exams, but like it's helpful to know like the other stuff too.
Yeah.
But we might not necessarily be tested on it.
No.
Okay.
Yeah, I mean, I do recommend that you, Levi. I do recommend that you read the book, but and I'll send you the slides for, the video for 6, but I literally read everything, almost those slides are word for word out of the book, word for word. And I did that last term, and I don't think that I don't think it made any difference. Like, I'm trying to not read the book, I'm trying to give you, I'm trying to give you that, not that you have to learn it, not that I'm not asking you to teach yourself, because I'm always here if you have questions. So if you're reading something and you want to know more about it, let me know and we can talk about it. But I'm highlighting, the important stuff, the stuff that is, like you need to know how the enamel is formed, and that is through the Tomes process, that is what, from the ameloblasts, and the odontoblasts is what gives us our dentin, and how that process happens. But again, this was the process of how it happens, is the embryology part of it, and then we're going to talk about the histology part of it next week. Yeah. Anything else? All right, enjoy your weekend. Thank you very much. And I will see you Wednesday at 2, because I still have to drive up to campus and drive back. So 2 o'clock on Wednesday. Okay. All right. Bye, you guys.